बिस्मिल्लाहिर्रहमानिर्रहीम। My journey to dentistry. लफ्ज़ों की शिफा हाथों के हुनर से पहले, before the healing of hands comes the healing of words. My name is Dr. Salima Naveed Manji and I am competing for faculty category. My journey to dentistry has never been limited to procedures, materials or techniques. It has always been about patients, people, society, community, about how we speak to them, understand them and earn their trust. Because in dentistry, communication is not an accessory, it is the foundation of care. The journey begins with a simple but uncomfortable question. अगर इलाज बेहतरीन हो मगर बात ना हो तो? Our dental students were skilled. They had knowledge, confidence, clinical abilities. हुनर था मगर राब्ता ही कमज़ोर था. There was no structured training in communication, no framework to help students navigate patients' emotions, fears, expectations. And I realized this gap mattered. The dilemma, particularly in dentistry, is not only clinical science, it is the human interaction. If a patient does not feel heard, even the most technically perfect treatment can fail. ये वो मकाम था जहाँ सोच ने समात बदली. The dilemma was clear. Were we producing clinicians who could treat disease or professionals who could truly care for people? The goal was never a single workshop. The goal was a cultural shift, particularly cultural communication shift. A shift where communication becomes a core clinical skill, not an optional soft skill. We envisioned graduates who meet international standards of cultural communication, who can serve a diverse society with empathy, respect and effectiveness. Because excellence in dentistry begins with understanding the patient. An idea evolved into a framework and the framework into a 4-year integrated curriculum. Communication skills were embedded into lectures, workshops and structured trainings. 4 years, एक मुसलसल मुकालमा. Communication was no longer taught in isolation. It became part of daily learning, reflection and assessment. Change was visible. Students began seeing patients, not cases. Cultural richness was acknowledged. Treatment became patient-centered. And then came the realization. Great clinicians were built through communication. For the first time in Pakistan, a structured communication skills curriculum was developed for undergrad dental students and formally assessed through OSCEs. The learning progressed systematically. Pre-community visit communication in first and second year lectures, basic communication skills in the form of workshops in third year, and cultural communication competency and advanced doctor-patient communication was given in final year BDS. ये तरबियत बतदरीज पुख्तगी की तरफ बढ़ी. Each stage prepared students for the next, ensuring growth, reflection, and professional maturity. Every patient brings a story, shaped by culture, beliefs, fear, and values. Targeted workshops were conducted, OSCEs reinforced learning. Students learn not just what to say, but how to say it and why it matters. क्योंकि सकाफती हसासियत इंतखाब नहीं, जिम्मेदारी है. To teach communication effectively, everyone had to be trained. Students, facilitators, standardized patients were trained together. ये तरबियत बतदरीज पुख्तगी की तरफ बढ़ी. This journey expanded into research and publications, allowing knowledge to move beyond classrooms and contribute to the dental and academic community. And today, I share this journey as service to society. Communication was assessed with the same seriousness as clinical skills, because what is assessed, it improves. After extensive deliberations, a universal OSCE was developed. This created a sustainable assessment pool supported by standardized assessment sheets for cultural communication skills. ये सिर्फ निज़ाम नहीं था, ये सिमत की तब्दीली थी. This is not just a program, it's a mindset shaping safer, kinder, and more effective clinicians. Because dentistry is not just about treating teeth, it is about earning trust, respecting diversity, and healing with humanity. That's why we always say that cultural communication skills are the cornerstones of dentistry. Shukriya, Allah Hafiz.